Good day. I am Dr. Wilfredo S. Tagle, urologist. And welcome to Medical PracTIPS. It is a series of tips and tricks to help you start your medical practice. For today's episode, we will be talking about when to refer a patient. It is a crucial decision that balance your expertise, the practice of patients' needs, and the complexity of their condition. The situations that needs referral from your care to other services includes number 1, specialized care or alternative care providers. Number 2, other diagnostic complexity of cases. Number 3, lack of improvement of patient's condition. Number 4, multidisciplinary care are needed. Number 5, resource limitations. Number 6 is the patient's preference. And lastly, number 7, your affiliations to your patients. One thing to look out for would be patients needing specialized care or alternative care providers. Referring to a specialist is essential if the patient's condition requires specialized knowledge or skills beyond your expertise. This also applies to treatment. If the treatment plan involves specialized procedures or requires specific resources not really available in your center or practice, don't hesitate to refer to another physician who could be considered and available. You should also take note of the diagnostic complexity of the case. Take note of cases where the diagnosis is unclear or requires specialized tests that is not under your expertise. Alongside this, you should watch out for any red flags or any signs and symptoms that need immediate re-evaluation. Referring patients with these signs and symptoms to another physician may help them an accurate diagnosis and, after all, an appropriate treatment. A lack of improvement of the patient's condition could also be a reason for referral to another specialist or to another center. If the patient's condition does not improve despite appropriate treatment and interventions, please don't hesitate in referring to a specialist that can help provide fresh insights and alternative perspective. Patients who require multidisciplinary approach for treatment and diagnosis also needs referrals. Conditions that are considered multidisciplinary are those involving different medical specialists. Resources limitations may be an indication for referral. If your center doesn't have that kind of resources or the patient doesn't have some resources, enough resources, if your practice lacks necessary resources, equipment, or personnel for the management of the patient, a referral to a better equipped facility is needed. Sometimes, patient's referral may also be a reason for referral, or the request of the patient could always be a reason for referral. Patients may request a second opinion or express a preference for another specialist due to their reputations, previous experience, or personal reasons. Respect the decision of the patient. It is important to give autonomy in those kinds of situations for the patient. Lastly, physician's affiliation to their patient also indicates referrals to other physicians, especially in the case of first-degree relatives, your wife, your children, and your patients, your siblings. Referral to other physicians are highly encouraged. This is to prevent bias in decision-making. Patient referrals involves recognizing the scope and limitations of your practice and your patient's needs. Proper communications is crucial when deciding if a referral is needed and explaining to your patients the rationale behind this decision for their treatment plan. It is always for the good of your patient. So, that's it for today. Like, follow, and subscribe to our Facebook and YouTube page. To catch the latest episode of Medical PracTIPS every Wednesday at 7 p.m. Please share this episode of Medical PracTIPS so we can help more young aspiring doctors build their practice and better serve their patients. See you. Bye-bye.